Alrighty, so this is our final project for veterinary microbiology. All right, so the structure of bacterial cells is the capsule that it provides a prolonged survival in the environment, cell walls that are responsible for the shape of the organism, cell membrane involves the active transport of nutrients, respiration, excretion, and chemoreceptions. The flagellum is responsible for motility. The chromosomes hold the DNA, and the ribosomes involve protein synthesis. The introductory to bacteriology is the bacterial infections are influenced by the characteristics of bacterial pathogens, include the genotype, the route of entry, resistance to host defense, and tissue tropism. The characteristics of why can't I say that word? Susceptible animals includes species, sex, age, breeds, and physiological status, and the predisposing factors, which include stressful environments, immunosuppressions, and low standard of hygiene. Immune systems have innate immunity and adaptive immunity. The innate immunity are cells and the anatomical structures of mechanical activity, and the adaptive immunity is active and passive immunity. The Listeria species. No. Go back. I am so sorry. The Listeria species are small gram-positive rods, and it is found in environmental on herbages and fresh water. May be present in feces and sewage effluent. Its tolerant pH values are between 5.5 and 9.6, and there are two pathogenic species. Listeria monocytogenes, which affect sheep, cattle, goats, and birds, and Listeria ivanovi, which affects sheep and cattle. The Clostridium species can be differentiated by their colonial morphology, by toxin neutralization methods, biochemical tests, and by molecular methods. There are 4 groups of Clostridia, which are neurotoxic Clostridia, histotoxic Clostridia, interpathogenic Clostridia, and atypical Clostridia. The notable diseases that Clostridium causes are botulism, gastroenteritis, tetanus, and Clostridial necrotizing enteritis.
So week 5 was the Bordetella species. There are actually 8 subspecies of Bordetella that there are, but the 4 main ones that are important to human and animal pathogens is B. pertussis, B. parapertussis, B. avium, and B. bronchioseptica. You can go on to the next one. Bordetella can be defined by its growth characteristics, biochemical reactions, and the ability to agglutinate red blood cells. It can either be small gram-negative rods that are found in the mucous membranes of the upper respiratory tract, or it can be strict aerobes that grow on non-enriched media. Most of the time, the clinical signs of Bordetella are upper respiratory tract infections of young or unvaccinated animals. Transmission is primarily through respiratory secretions and can spread fast, especially in a kennel setting, hence the name kennel cough. Infection can be treated and is usually non-fatal. Leptospirea. Leptospirea is a subspecies from the genus Spirochetes. This bacteria has a spiral or helical shape that is gram-negative. Leptospirea survives well in ponds, rivers, surface waters, and moist soil. This bacteria can cause many diseases, but the one that occurs most often is leptospirosis. Leptospirosis is a zoonotic disease that can be transmitted from animals to humans. Clinical signs of leptospirosis can include acute nephritis in pups and chronic renal failure in adult dogs, abortions in sheep and cattle, an influenza-like illness, and occasionally liver or kidney diseases in humans. It is usually spread through the urine in wildlife. Leptospirosis can be fatal if left untreated. Malaysia pachydermatitis is a type of yeast that can be found on the skin of humans and animals. It is aerobic, non-fermentive, urease positive yeast. Can be associated with two clinical conditions, otitis externa and dermatitis. The colonization and growth can be associated with animals who are immunosuppressed. Immunosuppressed animals are animals with predispositions such as moist skin folds, poor ear conformation, and excessive use of antibiotics. Most treatments can include miconazole, chlorhexidine, shampoo, or a combination of topical and oral ketoconazole.
Okay. So in week 9, we covered herpes virus. So as a family, it can infect amphibians, birds, fish, or mammals, including humans. Um, the virus will replicate in the cell's host nuclei. It can cause lifelong infections, and once infected, the virus can lay dormant until the immune system is weakened. Viral shedding can be continuous or during times of stress, such as transportation, boarding, or during adverse weather. There is more than 100 viruses in the herpes family, so it's divided into 3 separate families. The alpha herpes virus, which replicates and spreads quickly throughout the host. The beta herpes virus, also known as the cytomegalovirus, which replicates slower, and once infected, the cells would begin to enlarge. Gamma herpes virus, which primarily infects lymphocytes and can vary in replication time. So the major disease that comes from herpes is canine herpes virus number 1. It causes a fatal and systemic disease in puppies, and it often occurs in newborns. The virus is shed through the oral nasal or vaginal secretions of the mom. Newborns can become infected during whelping or in utero. Canine herpes virus thrive in cooler temperatures, leaving neonates who can't control their weather most at risk. The puppies that are suspected of herpes will stop nursing. They'll have difficulty breathing, cry persistently, and can suddenly die. A diagnosis can be made through a post-mortem examination from stillborn puppies or puppies that suddenly died. Prevention is more successful than treatment. Treatment really just includes antivirals. And then prevention, pregnant dogs should be isolated for the last 3 weeks of pregnancy and through the first 3 weeks after the birth of the litter. In week 10, we covered different parvoviruses. So a parvovirus is small, it's unenveloped, and is a single-strand DNA, which will replicate in the nuclei of dividing host cells. Once the virus has entered the cell, it will transform into a double-stranded DNA and release, causing the host cell to replicate and create more ineffective cells. It's a stable virus that can last in the environment up to months or years, and it causes feline panleukemia, canine parvo, and porcine parvovirus are the most commonly seen in veterinary practice. So the parvovirus can infect young canine species. This is dogs, coyotes, anything that's dog-like. The virus can present as acute gastrointestinal issues such as vomiting or heavy and bloody diarrhea. Clinical signs also include lethargy, anorexia, fever or hypothermia, abdominal pain, and it's highly contagious and can be transmitted through the feces of infected canines. So it has an incubation period of 4 to 7 days. Puppies can decompensate quickly due to not eating or not having enough fluids. Treatment is supportive and aimed to hydrate and maintain the weight of the animal. Prevention is done through a series of vaccines. Usually, puppies are vaccinated around 6 to 8 weeks and should be vaccinated every 3 to 4 weeks until after they're 16 weeks of age, and then annually or every 3 years. The coronavirus is a large, multi-shaped enveloped virus. There's singular molecules of linear positive sense single-stranded RNA. The virus family is made up of 4 subfamilies: the alpha coronavirus, which has the feline coronavirus, canine coronavirus, or transmissible gastroenteritis virus. Beta coronavirus number 1 includes the human coronavirus, OC43, bovine coronavirus, porcine hemangioagglutinating encephalomyelitis virus, equine coronavirus, and canine respiratory coronavirus. Gamma coronavirus, also known as avian coronavirus, which includes infectious bronchitis virus, turkey coronavirus, pheasant coronavirus, duck coronavirus, and pigeon coronavirus. And another family is the torovirus, which has the equine torovirus, bovine torovirus, and the Baffini virus, which affects fish. Coronavirus will replicate in the cytoplasm of cells. They are sensitive to heat, lipid solvents, formaldehyde, oxidizing agents, and non-ionic detergents. The stability of coronaviruses with low pH values vary. So this virus the feline infectious peritonitis, which is a clinical disease and is infectious and almost always fatal. It's not completely understood. Most commonly seen in catteries or multiple cat households. It is transmitted through the oral fecal route and also in litter boxes. The clinical signs are often vague. They can be lethargic, decrease or not eating at all. They have weight loss and fever. There's 2 forms of the virus, which is the wet form, where fluid can be seen in the abdominal or the thoracic cavity. This is thick yellow fluid. Swollen abdomens can be seen, or they can have difficulty breathing. Or the dry form, where there's no fluid accumulation, and the organs such as the eyes, brain, liver, and intestines are inflamed, and ocular discharge is often the only clinical sign seen. Some cats may be exposed to the virus, but can develop a response from the immune system, which causes very few cats to actually develop symptoms. So there's an active infection, which can last from weeks to months. Cats can be reinfected and may or may not shed the virus. The virus will mutate and attach itself to the macrophage and kill it and travel to the core of the cat. That's how it travels to the body. Viruses' ability to mutate causes it to become makes it hard to test and diagnose. And treatment is usually supportive and may extend and improve the quality of life, but there is no cure. Prednisone can be used to treat an inflammation. And then once FIP has been diagnosed, euthanasia may be the only humane treatment.
Okay, in week 12, we touched on, so one of the parasites we touched on was the Elaerostrongylus abstrusis species, also known as feline lungworms. It's a nematode parasite that's found worldwide. It's non-zoonotic and it is host-specific, so it's only affecting cats. It's most common in outdoor cats that hunt and eat wildlife, so things like birds, frogs, snails, etc. Infection happens when they ingest the actual worms. And once the worms are ingested, the larvae do travel to the lungs within 24 hours and begin to lay eggs in the alveoli of the lungs. Larvae can be seen coughed up or seen in stool, rarely, but the worms are usually seen visually by being produced after coughing. Symptoms, so cats can be asymptomatic in mild cases, but in severe cases, you're going to start to see the respiratory signs. So coughing, dyspnea, wheezing, chronic cases can result in permanent lung disease or lung damage. And then there are GI signs such as diarrhea, anorexia, and emaciation as well. Diagnosis is usually done by doing a transtracheal wash to look for either the larva or the ova, but sometimes you can see larva and ova on stool testing, fecal floating, but that's not as common as with the tracheal washes. And then treatment usually involves ivermectin, selamectin, and fenbendazole. And then we also talked about ancylostoma, also known as hookworms. Hookworms are also a nematode parasite. They are found worldwide, and there are several different types of them. They are zoonotic to people, and they are contagious to other animals. They are usually spread via the fecal-oral route or via skin penetration from the worms in the soil. Symptoms of hookworms, so animals can be asymptomatic. There will be GI signs, so diarrhea, anorexia, malnourishment, and emaciation. And in severe cases, it can result in hookworm anemia, which will need a blood transfusion for treatment. Diagnosis, so either fecal floating to look for the ova or fecal antigen testing that is sent off to a separate lab. And then treatment typically includes pyrantel, fenbendazole, and moxidectin. And then week 13, one of the parasites was Giardia. So Giardia can present in 3 different forms. So as the protozoa, the flagellate, and the cyst form, all of which can be seen on fecal testing. It is very zoonotic to humans, and it is contagious to other animals. Usually transmitted via ingestion of contaminated food or water, or the fecal-oral route. Symptoms, so with Giardia, carriers can also be asymptomatic, but they can also have acute or chronic GI signs. So vomiting, diarrhea, nausea, weight loss, and in severe cases, it can lead to delayed development and vitamin deficiency. Diagnosis is usually done with fecal testing. So on a float and a direct fecal test looking for the cysts or the tropes. And there is also an antigen test that you can send off to a lab as well. And then treatment, so medications used regularly are metronidazole and fenbendazole. And then environmental decontamination is essential to prevent reinfection. Okay, and then week 13, Sarcoptes, also known as sarcoptic mange. It is an ectoparasitic mite that is highly contagious between animals and also highly zoonotic to humans. And it is transmitted via direct contact with another infected human or animal. Typical symptoms include severe pruritus and also thickened raised lesions with cresting on the ventrum, hocks, the ear area, and also on the elbows. Dogs, though, that are well-groomed can be asymptomatic, also known as scabies incognito, just from being groomed. Having the lesions and the cresting and stuff groomed off of them, so it's not as noticeable as it would be with another dog that wouldn't be getting groomed as often. Diagnosis is typically based upon the physical exam, known exposure, and also the clinical history, and then also done via a skin scraping to look for adult mites and also ova. And in heavy cases, you might see mites or eggs in fecal testing as well on a fecal float from them grooming. And then treatment. So treatment, even if there is a negative skin scrape, it can be still recommended just based upon the physical history and any known exposure to another infected animal. Treatment usually consists of medicated shampoos, sometimes sulfur dipping, it's not as common, and then also the use of selamectin, ivermectin, and milbemycin can be options as well. And then environmental decontamination as well. And then week 14 was just an overview, basically touching on the essentials of prevention and control of infectious agents. So biosecurity was a big topic that we discussed as an essential of prevention. Basically, biosecurity is just a set of measures used to prevent the exposure and spread of certain diseases and pathogens. And the benefits of biosecurity are typically just a higher standard of animal health and welfare, ruling out and excluding certain pathogens from healthy animals. And then in production animal, it would lead to improved animal production and reduced portion costs or production costs. And then, so strategies for prevention to ensure biosecurity would be to use quality products and equipment, and also have high standards of hygiene. Wildlife control for sure, because they can bring in unknown pathogens, and then also requiring visitors to wear proper PPE. And then vaccination, of course, as well, to help ensure the long-term immune response. And that was it.
How do I stop this?